Good morning, students.
Good
Good morning,
morning,
sir.
sir.
Yes, good. Study of socialization. We had been learned that the socialization socialization in hospitals, socialization in families, so which means general aspect of studies and specific aspect. We are nursing professionals need to know the socialization in hospitals. Then rehabilitation. Today we are going to deal with rehabilitation. What is difference between hospital and rehabilitation settings? The hospital concern all hospital mainly focus on healthcare professionals. In rehabilitation means this patient aspect. When we interact with client, the socialization is how much important and that aspect of socialization. Therapeutic aspect. What do you think about rehabilitation? Which means treatment designed to facilitate the process of recovery from injury, illness, or diseases to as normal condition, which is rehabilitation. Then persons involved in rehabilitations in the hospital setting as well as in first person is that hospital administrators, then doctors, nurses, allied health professionals, patient or client family. The mainly this direct contact in rehabilitation setting, the nurses, doctors and allied health with patient and families. Then community. Types of rehabilitation. Physical rehabilitation, rehabilitation from physical illness. Mental rehabilitation, restore from mental illness. Social rehabilitation, recover from social disabilities. Then occasional rehabilitation, vocational, which means rehabilitation from these disabilities mainly restore to normal and develop skills vocational. Then factors of socialization process in rehabilitation setting. First factor, imitation, as we have discussed. Then suggestion. This setting only doctors and nurses mutually share the informations and suggest with each other. Vital signs suggestion by the nursing professionals regarding patient condition and history. Then doctors may be prescribed medicines, and given direction how to administrate that, etc. Then identification. Identify the real issues and client as well as the professional competence improving. Then language. In hospital rehabilitation setting, language is a key factor. So client-oriented language used to promote this socialization. Then only you can learn about the client and share this mutually health education and which promote therapeutic socialization. Then importance of socialization process in rehabilitation of patients. First important, restore from the all kind of diseases. Students, we had discussed that socialization is one of the important social medicine. Every diseases can cure by, can prevent, can rehabilitate. The socialization is one of the medicine. Second, to care give to the patients, client-oriented care. Through socialization, we can identify the client need. Need-oriented care we can provide. Third one, to cure the diseases, mainly physical illness, mental illness, social disabilities. Fourth one, to promote the health, promote physical health, mental health, and social well-being. Then diagnose the diseases, which is very important. Mainly nursing diagnosis concern to identify the client need, not only physical need, also their mental need and social needs. By means of the interact with client and learn about and mainly pursue, then experiencing empathy, the client what feel about, what they want by means of socialization. Sixth one, to counseling and guidance. So through socialization, we can identify the problems of the client and according to that, we can give guidance. Next important, to reduce mortality, save the life. So which is a fact. More socialization promote good healthcare outcome, which means therapeutic touches. When you touch the client, conceptually, for example, we thought about their families, their physical and mental and save the life. So not only this, when collect the information, rehabilitation concern, this teamwork, the doctors, nurses, and allied health professionals need to socialize with each other to share knowledge. The socialization is nothing but spontaneous interaction between the healthcare professionals. Students, many of them having misconception regarding the socialization. The socialization concern only thought about this negative socialization. Here we need to think about positive socialization, which means when you interact with other patients or when you interact with other colleagues or the other healthcare professionals purposefully, need oriented interaction and spontaneously interact, there is no restrictions, okay, which is a real socialization in hospital, which help to better care, better treatment, as well as reduce the mortalities and save the life in rehabilitation setting, mainly in acute care, emergency setting. The very professional work together and spontaneously interact with each other. So next section, interdependence of individual and society. Individual depends on society to meet their needs. Every parts of society created by individuals. Society mold individual personality. Here, to clear understanding about, apply a theory, Abraham Maslow theory. As we had been learned in psychology in first year, the hierarchy needs. First need is that physiological need, which is fulfilled by social society, mainly family. What are the physiological needs? Food, water, shelter, sex, maternity, etc., etc., which is fulfilled by family mainly. Then safety need, second need, mainly family as well as safety, provide safety, religion, God protect the people, belief. Then love and affection. The love and affection we can gain from all parts of the society, mainly family, husband, wife, parents, children, love with each other. Then religion, God is love. Then education, teachers love their own students, etc. Fourth one, self-esteem, self-confidence. Then Abraham Maslow says that it's a hierarchy of need. If a person fulfill the primary need, which means physiological need, then only we can person able to fulfill safety need. Next, love and affection. So it's a hierarchy of need satisfaction from the society. Then occupation, getting better job, we can experience good confidence. Fifth one, self-actualization. So self-actualization means a person fulfill all needs and achievement in the life by means of interact with every components of society and fluently interact with every components of society and know with everything and live, enjoy the life. So individuals depends on society to fulfill their needs, mainly this from the primary basic needs to self-actualization. Look at this pictures. This is a physiological need, primary need. Then safety, love, esteem, self-actualization. Next is that hence individual depends on society for satisfy physiological needs. And so first is that to satisfy physiological need, second to fulfill safety need. Next one is assure love and affection. Next, safety needs of self-esteem, then fulfill needs of self-actualization. Next section, interaction of body, mind and society. Sociological study of health is study interaction between social situation, mind and body. Students, here we need to think about what it mean by health. When we interact with environment, look at this picture, interaction. A man interact with society, first affect mind, just next affect body. So that cause stress. In every types of interaction having stress, the stress may be mild, moderate or severe. The severe stress only cause the diseases. Because the society means including family, marriage, religion. Mind is means psychology, the principles of sensation, perception, learning, motivation, every psychological factors involved. Then body means concerning physiology and anatomy. When a person interacts with society, the body and mind affected, influenced by situation, which is induced stress. Stress is cause root of all kinds of diseases. Look at this flow chart. When a person behave, just imagine ourselves, we have interact with society, behave in society. First brain affect. How to brain affect? Through 5 sensory organs, by eyes, nose, ears, and brain observe and perceive the information from. Next, nerve system involves sympathetic and parasympathetic nerves involved. Then affect immune system as well as endocrine system. Students, we have perceived good information, our immunity power will be increasing. We able to tolerate or able to manage the situations, immunity power become the better. But unable to tolerate the social situations and stress cause to declining the immunity power, the opportunistic infections. Detail going on. Stress. The term stress as it is currently used was coined by Hensley. In 1936, WHO defined it is a non-specific response of body to any demand for the change. Which means any change in the society, the body may demand. We have to respond. Everyone differently does response. Try to manage the situation by means of, in one of the technical word used, that defense mechanism, defense from the stress. Look at this. One of the pictures shows that brain, all the parts of brain involved when interact with society, affected by social situations, stress and health. The real measure of health is not the absence of disease, but the ability of the human organism to function effectively within a given situation. Students, which is a real health. Not only the absence of disease, a person living any situation, so for example, negative or positive situations, how to manage and how our ability to manage, that is a real health. According to Walter Cannon, physical change depends upon the individuals and perception. Different person having different perception and individual differences, which is determine the physical changes or diseases. Then physiological response to stress. Look at this picture. The person interact with society, experience fear or anxiety. Human body cope with that. Person experience stress. Try to manage the situations. The time of fear, anxiety. Try to manage it. That time we have been experiencing stress. The stress may be moderate, slight or severe. Look at this. The internal organs, mainly pituitary gland, first involved. The neuroendocrine system. So pituitary gland stimulate adrenal gland. Adrenal glands secrete adrenaline. So which is increasing the blood rate or blood pressure. Then central ventral portion of the brain, the nervous system, all the nerve system involved, parasympathetic, sympathetic. Sympathetic, autonomic. So which cause physiological changes. For example, abnormal secretion of hormones. Abnormal heart rate, abnormal breathing cause, and leads to diseases. So this is a way how person experiencing the disease. Okay. Then physiological changes mainly increase heart rate, rapid breathing, release of stress hormones, adrenaline, noradrenaline, increased blood pressure, muscle tightening often become very tight, change in blood flow circulation, heightened senses, perspiring or sweating, imbalance in normal hormone level. In addition to other changes, increase the central nervous system activities, mental activity, increase circulation of free fatty acid, increase output of blood cholesterol, so which cause the obesity, release of endorphin from the pituitary gland, then dilated pupils of the eyes, and hair straight on its end, which means goose flexion. Then increase brain wave activity, saliva dries up, decrease the perception of pain, then kidney decrease output, so which cause kidney diseases, bowel and bladder sphincter closed, which cause digestive issues, inhibits erection or vaginal lubrication, which means sexual disabilities cause. So these are the effect of stress effects when interact with society. Look at the students. This is a wonderful picture we having. For example, look at this. When we interact with society, first affect the hypothalamus. They're situated in pituitary gland. The pituitary gland stimulate the adrenal gland. Look at this adrenal gland, top of the kidney, and which is secrete adrenaline. So adrenaline is determine the, look at this heart rate. Heart rate will be increased. So when heart rate increase, breathing will be changed. Lungs, look at this lungs. So all organs in the body have been affected by social situations. So over stress, which cause stress, severe stress ended with diseases. Clear about, students? So this is today's highlights. How a person caused by diseases when interact with society. Now we have been everyday life experiencing different Everyday life we have been experiencing stress. Whether slight, moderate, or severe. Students, keep it in mind that severe stress only cause the diseases. So stress is part of life. We need to manage it. Look at this, every parts of the nervous system, sympathetic. Then system involved in this stress we will learn next class. So today's highlights is that this. So the mainly non-communicable diseases caused by the social situation and stress. So we need to manage this and make the happiness in society. Okay, now questioning time now. Thank you everyone. Have a wonderful day. Enjoy the day.
Thank you, sir.
Yes.